Good afternoon, everyone. Thank you for joining us on today's High Deductible PPO Plan webinar. My name is Marianela Morales, and I want to welcome you to this very excellent and exciting webinar. Before we go into the webinar, I want to introduce to you the presenters that we're going to have today, and as well as his team. Ryan Johnson is here with us today. He is with the Alera Group, our benefits consulting group. He's going to be presenting us what the high deductible health plan is, as well as the health savings account, and how you can take advantage of that. Ryan and his team, Renee Staley, have been a partner with us for several years now, and we are very thankful for their expertise, for their time, for their knowledge. So I know that this webinar is going to be great. Also with us today, and our team here, we have Reverend Robert Besser. He's our Center Director, as well as Mark Helms, our Controller. And then we also have Patricia Goforth-Brakes. And so all of our team here, we want to thank you for your time, for coming in here, for wanting to learn more about the high deductible health plan and how it best fits you and your family. So without further ado, I would like to ask Reverend Robert Besser to come and share a word of prayer, and we can start with the webinar. Robert.
Thank you, Marianela. Welcome, everyone. Will you join with me as we pray together? Gracious and loving God, I give you thanks for this time together and for the many ways that you provide for the people and for the ministries of the Texas Annual Conference. Bless the information to be shared in this webinar. Grant clarity to our presenters, attentiveness to those who are listening, and understanding to all who must make important decisions for themselves, for their families, and for their churches. Remind us that behind every policy and every plan are people, pastors, families, congregations who are called to serve you with strength and with joy. Guide our hearts toward wisdom, our words toward encouragement, and our work toward your purpose of care and connection. We ask this in the name of Christ, our healer and our sustainer. Amen.
Right. With that, thank you very much. My name is Ryan Johnson. As Marianelle mentioned a moment ago, I work with a group called Alera Group, and we are your benefits brokerage and consulting firm. And we've had the pleasure of working with the conference for a number of years. And today, I'm going to talk to you all again about how the high deductible plans work and how they are paired with health savings accounts, an HSA. Which is an opportunity for you all to enroll coming up here for your 2026 plan year. We've had a high deductible plan in place for the conference for a number of years, and we've seen a really large increase in the participation of the high deductible plan in the last couple of years. And I believe that's due to a lot of the communications and education that everybody has been receiving more recently on how the high deductible plans work and the HSAs. So we want to make sure that we continue to provide information so that you can make the best decision that fits your needs and your family's needs for 2026. If you have any questions as you go along through this, I'll take a few breaks and just pause and ask for questions. We also have a chat feature, so you can submit your question along the way, and Marianella or team may interrupt me as we go through here to cover the questions. So with that, I'm going to share my screen, and I'm also going to let you guys know about where some of these resources are available to you to view online. So let me share my screen here, and we will get going. Okay, can we see the slides and hear me okay?
Yes.
Great. So first I want to talk about the difference of the plans. So You can see on the left-hand side, this is talking about a high deductible health plan, and it provides access to United Healthcare's Broad Choice Plus network and their discounts. The other option is your standard PPO plan. Both plans have the same network, which means all the same doctors overlap within the high deductible plan that overlap in the standard PPO. So we're getting the same network with both of them. We're actually covering all the same conditions, same procedures, same drugs. The difference is the cost share between the plans. So the high deductible plan gives us the opportunity to pay a little bit less in premiums on the front end, and it's a bit more of a pay-as-you-go approach. Okay, so instead of paying more money in premiums up front for copays, you're going to save money in your premiums up front, and then you're able to open a health savings account. You can see on the right-hand side, there's a debit card that you're able to get that helps you pay for those out-of-pocket expenses throughout the year. So I'm going to walk you through the dynamics of a high deductible plan and a health savings account. So moving on here to the second slide. In order to participate in a health savings account, you have to be enrolled in a qualified high deductible plan, which is what we are offering through Texas Annual Conference. An HSA is a special tax advantage bank account, think of it, where you can put aside tax-free dollars and you can earn interest tax-free, and withdrawals will also be tax-free as long as you're spending your funds on qualified expenses, which I'll address here in a little bit. The great thing about an HSA is the money is always your money. Some people think of them like a flexible spending account, but the advantage to an HSA is there's not a use it or lose it provision, meaning once you put money into an HSA, that is always your money until you spend it. Okay, so that money can grow over time. Think of it like a 401k, an investment option for you for your health expenses. So you could put aside money into your HSA every single year and never use it, and just let that money continue to grow that you could use for Medicare expenses or something else along the way down the road. So the beauty about this is you can see this next bullet, you own the HSA, so you keep the funds even if you were to change jobs, roles, or changing health insurance plans. That is always your money. You're not going to be forfeiting those funds. You can withdraw the money directly from your health savings account using your debit card, or you can let that money grow over time and use it for qualified expenses, which I'll cover in a bit. For 2026, there are IRS limitations of how much money you can put into your HSA. If you're covering just yourself, there's a limit of $4,400 per year. If you're covering yourself plus dependents on the health plan, you can put aside $8,750 for the 2026 calendar year. If you are over 55, there's a provision where you can put an additional $1,000 called a catch-up provision into your health savings account. So it's a great way for you to put aside pre-tax dollars and let those funds grow over time, or use them if you have any health, medical, dental, or vision related expenses. So those are some general items. Some additional information on here. So in order to be eligible, as I mentioned before, you have to be enrolled in a qualified high deductible health plan. You cannot be enrolled in a non-qualified plan. So your standard PPO is a non-qualified health plan. You can't be enrolled in Medicare, TRICARE, or another spouse's plan that is not a qualified high deductible plan. So it's really important for you to understand the eligibility rules and understand if you qualify for those or not. You cannot be receiving funds from the VA, and you also, in order to contribute to an HSA, you cannot be contributing to a healthcare flexible spending account or an FSA, maybe through your spouse's plan. Again, it's your responsibility to understand if you are eligible or not based off of your specific situation. If you have any questions on that, you can reach out to your CPA if you have one, or if you have some pretty basic questions, you can reach out to Marianelle and she can reach out to us, and we can help make sure that we answer those questions for you. So as we talk about contributions, I mentioned before the annual limits of what you can put aside. You can fund your health savings account with tax deductible money, and you can fund it at any time throughout the year, similar to how you do an IRA. You have all the way up until April 15th of 2027 to fund your 2026 HSA. You can actually change your elections on a month-to-month basis. So some folks will elect to put a lump sum of dollars into their HSA after they open the account. And one thing on that, in order to open an account, you have to be enrolled in a qualified high deductible plan. So you can enroll in the high deductible plan now. That will become effective January 1st of 2026. After January 1st, 2026, after you're actually enrolled in that plan, so it's actually a live plan, then you can open a health savings account. Okay. And once you open that, you can put those funds into the HSA. As I mentioned, you can do a lump sum in the beginning. If you want to put $1,000, $2,000, whatever you want to do up front, you're able to. Or you could set a set amount every month that you're going to transfer into your HSA. You might want to put $20 a paycheck or $100 a paycheck, whatever it might be. So you can make those contributions directly into your HSA bank account, and you will account for that on your 1040 income tax forms. Okay, that's how you're going to get the tax favorable treatment on those funds. You can also check with your local church that is running your payroll, and they may be able to submit your HSA expenses or deductions into your health savings account on your behalf, and then you get the pre-tax benefits of it up front. So check with your local church and see if that's an opportunity or an option for you. So you can set up an HSA with any bank of your choosing. You can use where your checking account is, maybe where your investment accounts are, or you can open it at another new bank. We do have information that is on the benefits portal that you can look up, and I'll show you at the end here. One option is HSA Bank, and they specialize in HSA accounts. This is just an option. You don't have to open it with HSA Bank. It's up to you to do that. Going on to the next slide, we'll talk about distributions. So distributions are tax-free if they're taken for qualified medical expenses. And you can see the IRS code 213D noted here. Some examples of qualified health savings expenses are physician and hospital charges, lab x-rays, medications, medical equipment. You also can use it for dental and vision services as well. And this can help pay for your deductibles, your co-insurance within the plan, but also some things that maybe are not covered under the plan. Again, you can go to the IRS website if you have any questions about what is a qualifying expense and look that up yourself. You also can use these, when you're at the drugstore. Again, your medications, they'll be able to run your debit card, and you can pay for your drugs with your HSA dollars. Now, it's really important to understand that when you're putting money into an HSA, you are earmarking those dollars for qualified health expenses per this IRS code, which means if you are not using it for those qualified expenses, you would be subject to a 20% penalty, and also you'd be subject to income taxes on the money that you put into the HSA initially, because you avoided taxes on it on the front end. Now, I can't give you tax advice. That would be something for your CPA, but it's really important for you to understand the money you're putting in there. You need to be thinking about that is going to be set aside for your medical, your dental, your vision expenses for 26 or for future years. For 2026, we're showing here your employee contribution schedule. So this has not changed from the current 2025 rates. So if you're enrolling yourself as employee only, you're going to pay 3.25% towards of your annual compensation towards the health plan. If you're enrolling in the standard PPO, you're going to pay 6.75%. So you can see there's a really large amount more of contributions required for the standard PPO than they are for the high deductible plan. So over the next few slides, I want to walk you through a couple scenarios of how it may play out enrolled in the high deductible plan versus the standard PPO, of what your premiums would look like, and combining that with your out-of-pocket costs. So just have a couple of slides. And what I would encourage you to do is take a look at this information, look at what your utilization has been maybe in 2025, maybe in 2024, and project out what it might look like in 2026, and do the math for yourself and for your family, and figure out what might be the most beneficial plan selection for you to make based off of your expected utilization in 2026. And so these charts will give you a template that you could use and just figure out if it works for you or not. So moving on to
Ryan,
slides.
before we move on, can you go back to that slide where you show the percentages?
Yes.
I just want to clarify that this is for clergy, okay? Because we do have some current conference lay employees in this call. And so I just want to make sure that this rate that you see here on the screen is for clergy only. Our conference lay employee rates are a fixed amount, and that is in your open enrollment packet as well as on the website. So I just didn't want any confusion on that. And while I have your attention, I also want to let you know that we do have a question about what you were talking about recently, and I'm going to read it to you. It says, if I already have an HSA account from my time before I became a clergy, I want to confirm that I can continue to use it and add funds to it. Do I not have to set up a new one? Correct. Yes or no?
Correct. That's a great question. If you have an existing health savings account, that money is your money, and you don't ever have to forfeit it. You could continue using that health savings account if you want, and as long as you're enrolled in a qualified high deductible plan, you can add to that. Okay. So if you have a previous employer that has and you have an HSA, you can continue using that same HSA on either plan with whatever funds are in it. In order to add more funds to that HSA, you need to be enrolled in a qualified high deductible health plan.
As a current clergy in our plan, correct?
Yes.
Okay.
So that brings up another important point. So if you have, let's say you're enrolled in the standard PPO in 2025, and you want to move into the qualified high deductible health plan, that HDHP, in 2026, where you can open an HSA. You're able to open your HSA after you enroll, after the plan becomes effective, so after January 1st. You can only use your HSA dollars for expenses that have been incurred after you open your HSA. So if you have deductible or co-insurance under the standard PPO plan, let's say in December, and you move over to the high deductible plan in January, things that were incurred in 2025 are not eligible for HSA reimbursement because they were incurred before you had your HSA open. So something that's really important to understand, the expenses need to be incurred after the HSA has been opened. But yes, of course, you can use an HSA account from a previous employer if you still have some funds that have not been yet depleted.
Okay, thank you, Ryan. We have another question. And this is a clergy saying, once I turn 65, am I no longer allowed to contribute to an HSA? Question. What if my spouse is under 65? Question. Is signing up for Medicare the same as entering into Medicare? Maybe that's a question for the Medicare session, but the other two.
It is. I can hover over a little bit of that information here. So you can't be enrolled in Medicare. Okay. So being eligible for Medicare, but waiving it, you can still be enrolled in a high deductible plan and enroll in an HSA. So you can't be enrolled in Medicare and getting Medicare benefits. If you do, you're getting benefits before the minimum deductible that makes it a qualified high deductible health plan. Did that answer that question, Marianelle? There's another piece to that about the spouses. So just hypothetically speaking, without knowing exactly what your situation is, you could have one spouse on Medicare and one spouse on the Texas Annual Conference plan. Okay. If your spouse is getting Medicare benefits, that may not impact your election. Now, again, this is hovering into individual taxes and how that operates, and I'm not a CPA and I cannot give you tax advice. So if you have a particularly complex situation, you may want to check with your CPA, or you can do some research on your own to see if you are eligible for an HSA.
Thank you, Ryan. We have another question. It says, if I've moved back to the standard PPO, what happens to the unused funds that were applied to my HSA account while I was enrolled in the high deductible health plan?
Good question. So I'm going to go back another slide. So you own the HSA. So you keep the funds even if you change jobs or health insurance plans. This is that fourth bullet point right here. I've just found a laser pointer that we can use. So you own these funds. And so if you want to try the high deductible plan in 2026, open your HSA in January. And then in 2027, you move back to the standard PPO. All of the money that you have contributed into the HSA while you're enrolled in the high deductible plan will be your money. So you can use it in 2027 in that situation for your copays, deductibles, dental, vision, anything like that. You could continue to leave it in your own account and let it build and grow if you wanted to as well. It's up to you to do what you want with those funds, but they roll over year. You don't lose those funds ever. You just need to make sure that you're using them for qualified medical, dental, and vision expenses as outlined in the distributions from the IRS publications.
So to clarify, Ryan, let's just say I'm currently, hypothetically, in the high deductible health plan this year and I've contributed to my HSA. And next year I want to switch back to the standard PPO and I've contributed, $200. Next year, since I'm no longer in the high deductible health plan, can I take those $200 and continue to pay for my copay in the standard PPO plan? That's one question.
Yes.
Or can
You're gonna have your debit card?
Yes.
Yeah,
but
you'll
can
have your
I
debit card and you can just keep on using that until those funds are depleted.
Okay, no matter what plan, no matter if it's in the standard or high deductible.
Correct.
But can the money be withdrawn completely?
If it's withdrawn, you need to have a receipt or proof that it's being used for qualifying expenses. If it's not, then it would be subject to taxation and penalties. Okay. So I think we have it on this slide right here. So distributions from your HSA for non-qualified expenses are subject to income tax and an additional 20% penalty tax. So you're not going to want to use it for Christmas presents unless you're buying, eyeglasses for your kids, in which case you probably don't want to do that either. They're not going to be very happy with that. So you need to use those for qualifying expenses. Otherwise, you will have to pay a penalty tax as well as income taxes.
Okay, thank you.
Mm-hmm. What other questions do we have, if anything?
I don't see any new questions, but if we do, I'll let you know.
Okay. So moving forward here on the case studies that I mentioned before. So you can see on the chart here on the left-hand side, we're walking through a hypothetical scenario of an HDHP utilization. And on the right-hand side, this is a standard PPO utilization. And we're making some assumptions that I am a single person and I make $90,000 in base salary. Again, as Marianelle was mentioning, this is talking to the clergy contributions. You do similar math if you're a lay person to look at your deductions. But I'm going to spend $29.25 per year in premiums. If I have minimal expenses throughout the year, let's just say I'm on the high deductible plan and I have a monthly medication, maybe it's a maintenance medication. I'm taking 12 doses at $15 a piece. I have $180 in pharmacy expenses for that monthly medication. If I'm enrolled in the PPO plan, same cost. I'm going to spend $180 in pharmacy. But you can see at the beginning over here, I'm going to pay more money in my salary or my contribution just based off of the percentage being higher on that same salary. If I'm going in for a couple of primary office visits, under the high deductible plan, you don't have copays. So you are going to pay the contracted rate that United Healthcare has with that particular facility. Okay. If you're on the standard PPO, you can look on the benefit summary pages and it will show you what your copays are. It might be $25, it might be $75, $50, $250, depends on what you're going in for. There's different schedules for what those copays are. But for a high deductible plan, you're going to pay the contracted rate with that particular doctor. And it could vary doctor to doctor. Okay. So part of what the high deductible plans are intended to do is to make you a good consumer. Much like Robert was talking about yesterday, where we have responsible utilization with your power, right? When you're on a qualified high deductible plan, you're not subject to a copay. You're going to pay whatever the contracted rate is. So you might shop for care. You might find what the cost is for a drug at one pharmacy versus another, and you might choose to drive another 2 blocks to get a lower prescription cost for the exact same drug. Same thing with doctors. You might shop around and find that Dr. A charges more than Dr. B. So you're going to make some decisions based off of the cost that you then see as a consumer, because these are more consumer-directed health plans, as opposed to the standard PPO, where you have a set copay. No matter what that in-network doctor is, they all have the same copays for the same specializations. Okay. So in this example, I'm going to pay $220 for 2 visits. And as I said, this is just an example. The doctor visit might be $90. It might be at $212. Just depends on what that contracted rate is with that doctor. I'd say for a primary care visit, it's about $110 on average here in our region here in Texas. For a specialist, it might be 2 or 3 times that dollar amount. One of the things I had suggested to do is if you look at your EOBs, your explanation of benefits over the last couple of years, you actually can see what the contracted rates are with United Healthcare and your doctor. So you can see what what's called the billed amount is that gets negotiated down to the contracted rate. You can see what that rate is. And that then gets reduced down to what your copay is if you're on the standard PPO. If you're on the high deductible plan, you'll pay that contracted rate. So there's a billed charges gets reduced to a contracted rate. You'll pay that contracted rate. So it might be $110 for a primary visit. Like I said, it could go up or down $10, $30, $40, just depending on that particular doctor. And a specialist might be 2 or 3 times that. So my total out of pocket on the high deductible plan is $180 plus $220 is $400. On the standard PPO, my out of pocket is $180 plus $50 plus $230, or $180 plus $50 gets me to $230. So my out of pocket is lower on the standard PPO, but when I account for the higher premiums, I'm actually paying more to be on the standard PPO. So I'm paying $63.05 in my total expenses for the year, versus on the high deductible plan, I'd spend $30,325. Okay. This does not account for the additional tax savings. So you're able to pay this $400 with tax-free money. So there's actually additional savings when you account for your savings on taxes. One other key difference to be aware of with the high deductible plan, since there is a minimum threshold of what you as a consumer must meet in order to open an HSA, we are not able to have the deductible and co-insurance waiver on the high deductible plan when you go to Methodist facilities. So If you're going to Methodist facilities and you intend to continue to do so, just know that you will pay the contracted rate that we at the conference have with Methodist. It is actually a reduced rate from United Healthcare's rates, so we do have a direct contract with them, but we cannot waive the deductible or your coinsurance because of the IRS rules that would make the high deductible plan not qualified. Okay, so something just to be aware of, which may influence your decision.
Ryan, we have a question about HSA.
Okay.
It says, can you use my HSA funds for a spouse or a dependent if they're not a participant on my medical plan or enrolled in a high deductible health plan?
Good question. My understanding, and again, check the IRS regulations and check with your CPA. My understanding is they need to be a tax dependent of yours in order to use those funds, or in order to contribute to the account. But you can use those funds to pay for anybody's expenses. So, like my understanding is that you can pay for other qualified expenses for other people if you wanted to. But double check that with your CPA and make sure that that works if that's something you're wanting to do.
Thank you.
Mm-hmm. Okay. Our next hypothetical example, this is if I have a family enrolling and I am paying the same deductions based off of a $90,000 contributions. I'm paying $86.85 to be in the high deductible plan and $14,085 to be in the standard PPO. And let's just say hypothetically, we're going to reach the maximum out-of-pocket expense limits. Okay, so on medical, I'm going to spend $10,000 on the high deductible plan, and on the standard PPO, I'm going to spend $10,000 as well. So we have the same out-of-pocket maximums on medical. Our pharmacy on the high deductible plan actually this $10,000 includes the pharmacy out-of-pocket max as well. On the standard PPO, there's an additional $2,000 pharmacy out-of-pocket. So I'm going to spend $12,000 on the standard PPO versus $10,000 on the high deductible plan. So I'm going to pay less in my worst case scenario under the high deductible plan because $10,000 is less than $12,000. On my premiums, I'm also going to pay less. I'm going to pay $8,600 versus $14,000. So there's a difference of $7,400 less that I would spend enrolled in the high deductible plan with my family if we hit our out-of-pocket max compared to enrolled in the standard PPO and we hit our out-of-pocket max. Again, if you're using Methodist and you're anticipating to use the deductible and coinsurance waiver, that is not accounted for because in the high deductible plan, you would need to pay those deductibles. In the standard PPO, it would be waived. But I would encourage you to use these grids, these templates, and look at your utilization and see how that compares to what you're expecting for 26, and then you can figure out which plan is the best suiting plan for you. Now I'm going to stop sharing so I can share something else. I can figure out how to do this. Okay. So I am showing now on your website, on the conference's website, under your open enrollment materials, we have a lot of information that your team has put together. Marinella and Patricia have done a great job of putting a lot of information in here for you. I want to just highlight down here, you can see starting here at number 12, we have our high deductible health plans and HSA overview. And we have what is an HSA, and then also a flyer from HSA Online Bank. So these flyers are here to provide some additional information. Much of what we have talked about here today, maybe in a little bit of a different format or a kind of different summary. And then a couple more flyers that you can see here as well. And then this is a flyer from HSA Bank. That if you are interested in opening an account, you can visit hsabank.com and you can open up your account after you are enrolled in that plan. So if you're in the standard PPO today, you're going to need to enroll in the high deductible plan. Once you've made that election, your enrollment becomes live January 1, then you can open your HSA. With that, do we have any more questions?
We don't have any questions in the Q&A, but I have a question for you, Ryan. If somebody is in the high deductible health plan this year and they forget to open an HSA online account, what happens to that person? Of course, they did not contribute during the year, but the person, can they still open the account, let's say November or December, and contribute a lump sum to catch up to that max for the year, or they have to wait till next year?
Great question. So if somebody becomes live January 1, 2026 in the high deductible plan, and they delay opening their HSA, they cannot use HSA dollars for anything that was incurred before they open that account. Okay, so let's say you go all year and it's October and we say, oh man, I forgot about that, let me open it in October. You can do that, and as long as you're enrolled in the high deductible plan all year, you can get that full maximum HSA limit allowed. Okay, if you were to come into the plan mid-year and you're only covered by the plan for half the year, then you're only able to get half of the allowed IRS amount for the year. But if you're enrolled in the high deductible plan all year, you could open your account in December and you could still max out your HSA funds for the 2026 calendar tax year. But remember, you can't use funds deposited in, or you can't use funds that were deposited in an account that have been opened after you've incurred the expenses. So that's why it's really important to go ahead and open your account early in January. Even if you don't think you have any expenses, just drop $10 in it, $20, whatever it is, to get a minimum amount in that account. That way, if you do have expenses later on in the year, you can always back fund expenses into the HSA. Okay. So let's say I put $20 in January, because that's the maximum I feel that I want to do right now. And then in June, I have $2,000 in expenses. I have $20 in my debit card account. Okay. 20 is not enough to cover the 2,000. So you can actually deposit money into the HSA account in June, in the summertime, to then pay for those out-of-pocket expenses, because you had your HSA opened before those expenses were actually incurred.
Okay.
So it's really important we open accounts.
Okay, so in that scenario, if I were to open the account next year in December and I've been in it for the full year and I incurred that bill in June, I cannot use that to pay for that June claim, even though I was in the high deductible health plan, because I opened my HSA in December, correct?
Correct.
But I can still use it for the tax purposes, right?
Correct. You can still get the full maximum tax benefit. You just can't use it for those things that were incurred before you open the account. And then now you'll have more money saved up for 2027 your account that is always going to be your money. And if you move back, answer another question again, if you move back to the standard PPO in 2027, you could then use that money in 27 for your qualified expenses. So your copays, deductibles, medical, as well as your dental and vision.
Okay, thank you so much.
You're welcome.
I don't see any other questions here in the Q&A. But I think if you don't have anything else, we can conclude this meeting for the high deductible health plan. I do want to say that shortly at 2 p.m., we will have a Medicare session with Michael Steele. And if you would like to stay, it will be the same link. You can stay in this call And then at 2, we'll kick it up with Michael, and we can go over that. If not, you can come back at 2 and we can start that meeting. But we are not going anywhere. We're not going to close this meeting. This meeting is going to be opened. And then at 2, we will start with the Medicare session.
Sounds good.
Thank you so much, Ryan. Thank you so much for your team, for all the effort that you've put into this. We really appreciate it. We want to encourage y'all to look at open enrollment, and hopefully you can make the transition if it fits for you and your family.
You're welcome. Great to be with you.
Thank you.